Hello, dosto. This is Dr. RP here from IWSO. I'm meeting you once again in this particular channel. Here today we have got Dr. Lakshman, who is an eminent gastroenterologist, medical gastroenterologist with us. We are going to talk about a very common topic, which is fatty liver. Hi, Lakshman. How are you?
Hello, Raj. I'm fine. Thank you very much for this invitation.
Lakshman, thanks for offering your time in this particular channel. This channel, Lakshman, IWSO, as you have been associated with it for nearly 10 odd years now, is essentially a channel wherein people who wants a second opinion, especially in the scenario wherein they have already got a first opinion and been offered a diagnosis, offered treatment options, etc. If they want to get more clarity on that particular situation, they can always reach out to us by writing to us at iwantsecondopinion@gmail.com. This is a free, fee-based, no fee-based approach, and kindly subscribe to this channel to see more interesting videos which is of health importance to us. Anyhow, let's start with the talk, Lakshman, if you are comfortable. Lakshman, as we are talking about the fatty liver, what exactly is fatty liver and how prevalent is this in the general population?
Yeah, simply fatty liver means there is excess fat in the liver cells. So it looks more fatty. Like we people, we gain more fat, we look fatty. Same way the liver also becomes fatty.
Oh, that's in simple terms, okay.
Right. So this is relatively very common. I should say 25% of the population are affected by this problem.
You mean 1 in 4 out of every individual will be having this particular problem?
Yeah, that's right. 25% of the individuals.
Okay.
And in India, they say it is going to increase further, as in some of the Western countries, and it is becoming a pandemic soon.
Oh, all right. Okay. So, what are the primary causes for this particular fatty liver?
Yeah, for a few decades earlier, the commonest cause was the alcohol intake, excessive alcohol intake for years and years. Now, it is turning more towards the obesity, increasing the fat in the body that gets the fat deposited into the liver as well.
Okay. So, how does you are talking about change in the food habits and etc. So, what role does the diet play in the development and management of the fatty liver?
That's very important. Diet plays a very crucial role in development of this fatty liver.
Okay.
The diet is now where everyone is worrying about or interested about the Western health dietary habits, and they want to inculcate that.
Yeah.
That results in increase in the fat containing excessive diet, which contains more of fat that gets deposited into the body as well as in the liver. So, in addition to this, the sedentary lifestyle of people helps in this fat stored and it's not being utilized at all. So, it results in fatty liver.
Is it necessarily fatty food intake which causes the fatty liver, or any kind of a food can cause fatty liver, Lakshman?
Yeah, in the body, the fat or carbohydrate, whatever it is you're taken, can get converted into fat as a storage thing. So it's not just fat, and even the excessive carbohydrate can cause, it gets converted into liver, fat in the liver, and it stays there.
What about the proteins? If we are going to take high intake of protein, will it lead on to fatty liver?
If it's not properly, the person is not exercising properly, or dietary intake is too abnormal, it can get converted into fat and gets stored as fat in the liver.
So essentially the culprit is going to be carbohydrate and fatty intake. That's what it is. Yeah. All right. So in the olden days, it was mainly the alcohol which was the culprit. Nowadays, because of the change in the food habit, westernization of the food habit as well as urbanization that has been happening. These changes are all noted. Am I correct in saying so? Okay. Now, fatty liver, is it usually symptomatic, or if it is not symptomatic, how is it usually identified? Or if it is going to be symptomatic, what are all the common signs and symptoms in the patients?
Yeah, fatty liver is just deposition of fat in the liver cells. Many times it is excessive fat. Even little bit of fat is always there. Excessive fat. So it has become the difference between normal and abnormal is a faint line. So it's all fatty livers are not symptomatic.
Not symptomatic.
Incidental detection. But you should be looking out for this fatty liver in certain group of patients. So it is mandatory to have regular checkups than just waiting for symptoms. So symptoms wise, when the fat gets deposited excessively in the liver, it can stretch the liver. Liver can become big, and the capsule gets stretched. Then we get a dull aching pain. So sometimes little bit of jaundice and tiredness, fatigue. These are non-specific symptoms, but that's the reason why we should look for fatty liver rather than just waiting for classic later symptoms.
All right. Okay. You told that it is an incidental finding. What exactly you mean by incidental finding, Lakshman?
Patient or the person has no problems or has got something unrelated. When he gets a scan done, you can see that the liver is enlarged, fatty, or simply they have blood tests for something else. They look for the liver enzymes to be high. Then we chase that. He may not have any symptoms of the liver, pain, or jaundice, nothing, but still unrelated symptoms. He gets a scan, or routine scan as a master health checkup. They find out that this is there.
All right. So usually there will be enzyme level variations will be there, is it?
That's one of the early detection.
Okay. At any point of time, will the patients show any jaundice or raised bilirubin counts because of this fatty liver? In the early stages,
So, fatty liver resulting in jaundice is a late phenomenon. But before that, we should look for the liver enzymes and ultrasound pictures of the liver, which may show fat.
Okay. All right. Okay. Right. So, if it is essentially a disease process, so should we call it as a disease, or what should we call it as?
It's a condition. We should
it's a condition
rather than a disease as such, because it is reversible, and then it is what there's a faint line between normal and fatty liver. So it's difficult to call it as a disease, but it can become a disease.
All right. So, if that is going to be the case scenario, what are the preventive measures that can be recommended at the community level to, because you are telling that it is noted in almost 1 in 4 person, 25% is the population. So it needs to be addressed at the community level. So what are the preventive measures that we can put across at the community level in order to reduce the incidence of this fatty liver?
That's a very good question, Raj. Presently it's 25%. It is likely to increase further because of its associations with obesity and diabetes and other diseases. Now India is becoming the capital for diabetes. So it will be diabetes will be rampant, obesity will be rampant, and fatty liver will definitely follow it.
Yeah.
So what are the community measures? Yes, it's initially the awareness about fatty liver. What are the effects of fatty liver and how to prevent it? This awareness should be created and spread all over. That's the main thing. Second, there should be promotion of getting a healthy diet, which is very important. And of course, the physical activity should be encouraged rather than sedentary lifestyle.
Okay. So in nutshell, you're talking about 3 things. Number 1 is health education and making the public aware of what exactly the fatty liver is. Number 2 is nutrition, macronutritional variations, wherein you need to be considerate about fatty food intake and carbohydrate food intake. And third is increasing the fitness and be active and not to get the fat deposited in the fatty liver. Is that the 3 things that you are talking about? Lovely. Now, Yes. Okay. For example, if I am going to develop a fatty liver, it's from what you're telling, it is a 25% means yes, I might be enduring it. But the question is, once I found out incidentally from my ultrasound scan or something of the sort, is my fatty liver can be changed or reversed back to how it was before?
That's very important to know this, because in early stages, fatty liver is reversible almost completely. But late stages and some conditions which are causing fatty liver, which may it will the reversal depends upon individual patients also to a certain extent.
Okay.
So one is the underlying condition, secondly the determination to continue the lifestyle changes on a long term is helpful to get it
Okay.
reversed.
Okay. All right. Okay. So mainly once again it comes to lifestyle modification and how much willing are we and the determination we have in order to change the whole thing. Yeah. All right then. Okay. So, but the question I asked was, is it reversible 100% or is it not?
In early stages, it's completely reversible. Later on stages, when there is some changes which happen already,
Okay.
and inflammation and fibrosis, they are not completely reversible.
So, all right. So those are the later stages. But
Yes.
we are talking about the initial stages where it is nearly almost 100% reversible. Yeah. All right then. Okay. Now, if what will happen? I have been diagnosed with fatty liver on an incidental basis. I continue to ignore it. I don't change my lifestyle. So what happens to me?
Right. Whether it's an incidental detection or something related to liver symptoms, once you know that there's a fatty liver, it's not just deposition of fat in the liver cells. As this causes over time, it causes inflammation of the liver cells. We call it as steatohepatitis. So in the inflammation, that's the time when the liver enzymes start raising. They can
Okay.
rise further, and when there's a inflammation, it tends to heal by fibrosis. Like any wound, when it
Like a
heals,
scar tissue.
there is a scar tissue.
Okay.
So scarring in the liver, we call it as fibrosis, is the next step. And if you still ignore and it worsens, it can result in a condition called cirrhosis of liver, akin to what the alcohol causes liver damage, liver cirrhosis.
Okay.
Even if a person does not drink alcohol at all and is fatty over the years, he can develop cirrhosis, and it can have the same implications as the person who's been drinking heavily.
All right. Okay.
So
All right.
this results in cirrhosis, then further progress to liver cancer, like any cirrhosis.
Cancer.
Yes, it does. Cirrhosis, one of the end stages of cirrhosis is liver cancer.
Right. Okay. So if I have to consolidate in what you have told, the initial stage is the fatty liver, which is a kind of an asymptomatic variety, except for it can cause some dull achy pain. Not much of problem. But if it is left untreated, or if we are not going to take enough actions, then it can lead on to inflammation, which is called as an hepatitis stage. And then if it is going to be left as it is, then it can also progress to a condition called as a cirrhosis. And the cirrhosis is an irreversible kind of process. What about the hepatitis? Is it a reversible case, or it's also a kind of a irreversible case?
Initial stages, it will be reversible. And if it's at that stage, even if it's not reversible and if it's controlled, it will not affect the life. Liver will continue to work because liver has got enormous capacity to regenerate.
All right. Okay.
So, but if you cross this level, once the
Yeah.
scarring happens and scarring increases,
Yeah.
then it will become irreversible. So,
Right. So what percentage of the fatty liver gets progressed to the stage 2? What percentage stages goes to stage 3, and what percentage goes to stage 4? If you can, if there are any incidences that are available, if you can throw some light on it, please.
yeah, it usually depends on the individual persons and the nature, how much they are damaging their liver by the risk factors, and how long it has been there. So longer the duration and more severe the damage, naturally results in further later stages of
Right.
cirrhosis
Right.
and cancer.
In the general population, what would you say is the rate of conversion from fatty liver to the cirrhosis on an average?
It's a difficult number. 30% may progress to cirrhosis, and further, some of them will result in cancer.
And the incidence of cancer, the ultimate percentage, it's not an, I hope it is not a horrendous double-digit figure or anything of that sort. It should be a minimalistic single-digit figure, I guess. Am I right in saying so? Or?
Nearly so.
All right. Okay. So we need to be careful about that. At which stage the patient develop jaundice and stuff like that? Is it the second stage, which is the hepatitis stage? Is it?
Yeah, just fatty liver, they may not have any jaundice.
Okay.
As the liver cells get damaged more, hepatitis, the bilirubin starts increasing. Initially, if the bilirubin increases, it may not be visible as jaundice to the person. But
Yeah.
as the level of bilirubin goes beyond 3 times the normal, then you start developing clinical jaundice.
Right. Okay. So that's called as a clinical jaundice, which is 3 times the level of the bilirubin. That's when the manifestation of the symptoms happen, is it?
Yeah.
All right. Okay. Now, you told that fatty liver is a kind of a mechanism wherein we have to modify the diet and increase the activity levels. Could you please be more specific in letting us know as to what diet modifications that one has to put in place in order to try and reverse this fatty liver?
Right. Diet is the most important factor in causing fatty liver, other than in patients who take alcohol, excessive alcohol.
Okay.
So obesity should be corrected or reversed.
Okay.
One is important is the avoiding certain foods. In the Indian context, we see we eat a lot of deep fried food.
Okay.
That takes so much of fat in the body. Similarly, obesity should be prevented or controlled by taking smaller portions of the food, taking healthy food, and unmodified or not less of refined sugar and saturated fat.
Right. Okay.
So in we should say no. Now we are all getting used to the Western diet with fast food, which is actually yes included. It should be taken out. It should be a fat food, not fast food. So this causes a lot of easy calories without any nutrients, and it's also helps in reducing the amount of work. No cooking, directly buy it, and so more sedentary lifestyle and more food, which is not good. This obviously results in fatty liver.
Okay. What about, you're talking mainly about the fried food and stuff like that. What about the carbohydrates here?
Yeah. Refined sugars, I mentioned, is if you take refined sugars or beverages which are rich in sugar, it results in easy weight gain and fatty liver.
All right. Okay. So one has to be conscious of both the carbohydrate intake and the fat intake whilst you are trying to control that. Now,
again, with the fiber, the diet is very important.
Okay.
So that's why we should not use very refined foods. They should be.
What do you mean by refined food here, Lakshman?
They take away all the other fibers and other complex carbohydrates, which are split into direct sugars. And as soon as they eat the food, the glucose levels reaches high. Which is not good. It results in sudden surges in the insulin levels in the body that causes more of deposition of fat.
Right. Okay. Now, Lakshman, are there any medications that are available which will help us control this fatty liver apart from lifestyle modification by doing exercises and also dietary modifications? Are there any medications that are available to reverse this process?
So medications are not very helpful. The main thing will be the diet and activity, lifestyle. So medications are used to reduce the weight, control the obesity, and there are something which is working as antioxidants, which help to
Pardon me?
antioxidants,
Oh, yeah.
which reduce to reduce the damage to the liver or any organ in the body.
Right. Okay. Okay. Lakshman, interestingly, one of my friends who is not very heavy, or he is not a high BMI kind of an individual, but he does suffer from diabetes. And he was doing his regular ultrasound scan for some other reason, and it turned out to be he was having fatty liver. So, is there any correlation between a patient who is suffering from diabetes with normal or under par BMI, not under par, but normal BMI, to this fatty liver? Is it possible at all?
Yeah, it can happen even in persons who are not weighing overweight. There are so many metabolic factors which are involved, including some enzyme deficiencies in the body and increased insulin levels in the blood.
All right.
And diet, which can contribute to the fatty liver.
Right. So, diabetic patients can end up with a fatty liver disease despite normal BMI. Yeah.
Yeah.
And are the risks of irreversibility any different from the patient with a normal population without having diabetes, or how is it in those circumstances?
There are many risk factors for fatty liver, including diabetes, hypothyroidism, obesity, and there is association with hypertension, diabetes, and cardiac disease. We call it as syndrome X, where this comes as a group of this syndrome with a lot of manifestations like obesity, diabetes, hypertension, cardiac disease, fatty liver. This is a group. So these patients are prone to develop fatty liver, syndrome X. Even diabetes itself can contribute to formation of liver, fatty liver, which can be more progressive than the rest. So being diabetes, even if they are not overweight, they should have a regular checkup for fatty liver. Yeah, as you can note that the urban population with so many lifestyle changes have caused this great pandemic of obesity and fatty liver. So we should have a lifestyle which is healthy, diet, exercise, and monitoring. These are important. It's better to have a prevent this than trying to cure fatty liver.